Dr. Janet Seabrook, and I'm here today with Dr. Corey Hebert and Dr. Alric Simmonds. And we're going to talk about the vaccines that are available today from Pfizer and Moderna. So without further ado, I'm going to ask Dr. Hebert to start off the conversation, give us a slight introduction about what you're doing during this time of the pandemic.
Hello, Dr. Seabrook. I hope everybody out there is doing well amongst all this angst and holiday time where you can't really do the things you want to do if you want to do them next year. I'm Dr. Corey Hebert. I am a practicing physician and right now, jack of all trades and master of a few, and trying to just make sure that we can get through this thing. So I do a lot of media. I'm a medical editor for Black News Channel and NBC Television, a contributor to MSNBC. Just as an aside before we do all this, I just want to thank everybody that put this together, as well as the folks that are out there listening. Please just recognize that you're having mental stress, and I want you to recognize that and understand that this is a time that you have never, ever, ever felt. This stress you've never felt. No one in the world really has ever felt it. So just recognize that to this holiday season, and then we can go ahead and ask Dr. Simmonds, my Morehouse Hubert Hall brother,
yes, sir.
And his
Absolutely.
colleague, to say his piece.
Absolutely. Thank you, Corey. And thank you, Dr. Seabrook. So as Corey mentioned, my name is Alric Simmonds. I'm a general surgeon by training, but currently serve as the Vice President and Chief Medical Officer of about a 300-bed facility here in Orlando, Florida, known as AdventHealth Celebration. I'm also the Chief Health Equity Officer for AdventHealth, our nationwide enterprise, which comprises about 10 states and 50 different enterprises across those areas. So we treat about 8 million patients or so a year. And it's a pleasure to serve in that. Like Corey and Dr. Seabrook, all of us through COVID have taken on additional jobs. And today I hope that I can speak to two of those roles additionally that I personally have taken on during COVID. One is being the chair of our scientific review committee that has looked at, try to keep abreast of most of the data that's come out around COVID-19 since we started seeing cases in March. And then most recently, I was asked to sit on a panel chaired by our Chief Scientific Officer, Dr. Steve Smith, to actually look at and comment to and make suggestions for whether or not our healthcare institution and all of our employees should receive either the Moderna or the Pfizer vaccination. And I will say that I am the proud recipient on Friday of the Pfizer vaccine, because I think that that's really what we need to do to save lives going forward.
Well, thank you both for agreeing to participate in this show. And I'm happy that you both have received the vaccine. And that's really what I wanted to talk about today. There is this issue, particularly in the Black and Brown community, with the mistrust and distrust of vaccines as things have been done to the African-American community with medical trials and things like that. So just talk a little bit about your decision-making process in deciding to take the vaccine. And Dr. Hebert, we'll start with you first.
Okay. Yeah, so just as an aside, I'm a principal investigator and have a clinical trial facility that we've had for 20 plus years. And it's been an interesting time. African Americans, we have a historic distrust, and we should. And people always talk about the Tuskegee experiment, but that was an egregious thing, but that's not even close to the most egregious things that have happened to us as far as our distrust with the medical community. I mean, we go back all the way to the grave robbing so that medical schools could have cadavers, and they were only robbing slave graveyards and cutting on us for as guinea pigs, to even something as recent as Henrietta Lacks, where they just used her cells and made trillions of dollars off of them, and she's never received a penny, to using gold and silver and mercury, just putting it in African-American women's bodies for trying to cure cancer when they knew that it may or may not work. It's just, it goes on and on and on. So, but I will tell you, there's a really odd dichotomy when it comes to vaccines, because African-Americans vaccinate their children at a much higher rate than anybody else. So it's like, okay, you wonder why this is the case. So we know that there's something going on in our psyche here. So I did receive the vaccine, but I received the vaccine about 5 months ago because I'm the principal investigator of the Sanofi vaccine trial. And so before I got it, I was able to take that and get on a study. So I have to talk the talk, but I have to walk the walk as well. So I haven't received either one of the Moderna or the Pfizer, but I received the Sanofi, which will to let you know that there are going to be so many more vaccines coming out on the market in the next 4 to 5 months that you're going to have to make some decisions. But what I will say is that when I took the Sanofi vaccine, I felt nothing at all. I felt nothing. And as we are moving forward, most of my friends that have taken the Pfizer vaccine, because I haven't met anyone who's taken the Moderna vaccine where we're sure they took it, because the folks that I know that took the Moderna vaccine were on a trial, which means that they could have gotten a placebo or the vaccine. So we don't know yet. I don't know anybody that's taken it. But the people that took the Pfizer vaccine, and I'm sure Dr. Simmonds will address that, I haven't had had no really major issues. We've had 3 or 4 serious side effects, and they've all been in Alaska, which is ironic. But they've received epinephrine. One was on an epinephrine drip for a day, but everybody has recovered, and everybody's doing fine. So as Black people, before we talk about what we need to do, we have to frame the situation, know that we have a reason. It's not an irrational fear. We have a reason to feel this way, and we have to address that before we tell people what to do. So, yeah.
So, Dr.
Corey,
Simmonds, would you go in detail a little bit about yourself and receiving the vaccine, and if you've had any side effects?
No, so let me start with your last question. I've had absolutely no side effects. I took it Friday at about 7 o'clock in the morning, and very uneventful. I do want to I want to pick up where some of the things where Corey got started, and I think the biggest concern that we have, even if you think about the people who are being vaccinated right now, you've got political leaders who have been vaccinated. You have doctors and frontline healthcare providers who are being vaccinated. What we still have not done is vaccinated Latinx and brown people who are dying of this disease, right? And that's the next wave that we really got to do to get back to life as we know it. And we can't get there until we build a trust bridge. And everything that Dr. Hebert said is spot on. And then it's exponentially worse than you could possibly imagine. I've been trying to get through a book called Medical Apartheid. It's written by Harriet Pope.
It's so hard to read.
Heavy.
It's so hard to read.
You literally have to take
Do I
it.
need to pull it out a little bit?
You have to take it in increments, right? Because it is so burdensome with the pain that our people have gone through, right? And I just by mentioning it, I know you guys have gone into because your emotive reaction was so strong to it, and that is what our communities. It's almost as though it's encoded in our DNA to feel that level of pain and distrust. And so all that to say that it is a justifiable distrust that African Americans and minority communities, even when you think about the American Indians who were given smallpox under the auspices of a blanket through governmental forces, right? So, history is replete with these episodes, but I also think that having reviewed the data, having looked at the science and the evidence, that this really is a medical breakthrough. And I would hope that our communities really use action as a treatment for the fear, right? Because we're dying of this. And I will tell you unequivocally, when you look at the risk to benefit ratio, the benefit of protecting one's life from COVID-19 is far, far, far greater than any of the risk associated with this vaccination or any of these vaccinations for that matter. Well, I shouldn't say that. The ones that have been EUA approved. Let me say that much.
Yeah. And let me throw something in there too, because we as African Americans, we need to know our history, and I want everybody to go look up the trials and tribulations of a young man named Cotton Mather, who was a slave master who actually connected with his slave named Onesimus, who explained to him what they did in Africa with smallpox, so that they would take the smallpox lesion, and they would take a stick and rub it on the person that had smallpox, and then rub it on someone who didn't have smallpox, break the skin, and then people in Africa stopped dying of smallpox. He told this to his slave master in Boston in 1700s. The slave master ran with it. Everybody was like, "You're listening to your slave, you're stupid," or whatever. Anyway, his family did not die. And then they moved it further, and then they said, we have to do some clinical trials on this, but they couldn't use smallpox. They used cowpox, which is a disease that's similar to smallpox, but doesn't cause people to die. And then when they figured it actually did work, that's where the name vaccination comes from, because vaca is Latin for cow, and cowpox is what they use. So the father of the United States vaccination is a black slave named Onesimus. And if you go to Boston, there's a giant a statue there to that. So we invented all this stuff. We invented everything. So don't run from what we invented, because this is the way that science actually has come together for us to be able to get this vaccine.
So thank you for that piece of history. That's great information to know. There's so many things that African Americans have done to promote health in this country, and also invented so many things that help with everyday life, and we just don't get credit for it. So thank you for bringing that to everyone's attention that was not aware of it. I want to talk a little bit about the one-dose vaccines that will be coming out. And is there an estimated time frame for those one-dose vaccines?
Yes.
Yes.
Yes. So we have the GSK vaccine. We have the Sanofi vaccine. These vaccines are going to be more traditional. There's vector vaccines that are coming out, as well as some as the recombinant. So basically, what the mRNA vaccine is something that can be done very quickly. And the reason why is because we've had the technology, because it has been around since HIV and SARS. But the issue was, it didn't really make a lot of money sense, because medicine is about money, right? It didn't make a lot of money sense to mass produce a vaccine for a disease that usually causes a common cold. Okay. So they didn't really want to do that. But the reality is that the only way they would ever do that is if one of the viruses that cause the common cold has never been in humans before, which is what this situation, has led us to. So that was on the shelf, but they didn't have to invent it, but they had to make it so that it was available, and also make it so that it's easily manufactured and safe. And so the newer vaccines that are going to be coming after these two are more traditional in the way that they are manufactured. That's why it's taking so long. But I will say this: what we do, I'm writing an op-ed right now, because what I will not do is go back to where it took 8 years to make a vaccine.
Yes.
Because we know what we can do. So now all the bureaucracy and red tape that it takes for a vaccine or a treatment to come to market, we know that's a bunch of nonsense, right? If we really want to put our money behind it, if we really want to do it. So now I'm writing this because we can never go back to an 8-year time frame for any type of medicine or pharmacologic therapy.
I'm definitely in agreement with you with that. I don't believe that anyone will accept this lengthened process that we used to have in the past. I don't believe that anyone will want us to go back to waiting years for medications to be approved and for the trials to be completed.
Dr. Seabrook, I not to interrupt you, but I think that brings up a very, very important point, that as we talk about community adoption, the same technologies that Dr. Hebert is mentioning are some of the same things that give a lot of folks in the community unrest, right? So we have had these breakthroughs that have allowed us to not take 8 years, but you will see on social media the people who are questioning vaccinations as a whole they have great anxiety and fear at the way in which speed has been able to be adapted. And I think that we should not be afraid of that. In fact, we need to embrace that. And it needs to be a new standard, just as you're mentioning. This now needs to become the new standard by which we treat infectious etiologies and take care of population-based medicine.
Absolutely.
No, I definitely agree. How are we going to get back to a sense of normalcy for things like general surgeries and elective procedures and things like that, while we're waiting for the general public to be vaccinated? And I'll address that to you, Dr. Simmonds.
I mean, I think, so surgery has been challenged, obviously in many states where the positivity rate of testing went so high, they were closed to elective procedures. And, for most healthcare systems, financially, the operating room and the procedural spaces, as you all well know, are the economic engines that allow the hospitals to remain sustainable. So when you take that offline, you have a number of healthcare systems that, are struggling, particularly those who have very, very low operating margins. So, part of the case has got to be to continue to do testing of periprocedural patients, because there's been a lot of data showing that even for elective surgeries, those patients can have pulmonary related complications, with almost a third of them ending up in the intensive care unit, even for elective procedures. So part of it is universal continued testing of patients who are undergoing procedures. And that's everything from colonoscopy to bronchoscopy to anything that's invasive, robotic surgeries, colon, whether they're open, robotic, or laparoscopic, those patients should continue to be tested. From a healthcare setting in the hospital, we don't think that there's enough evidence to support universal testing of all patients, right? And there's some good global studies that look at that. The risk really seems to be in patients who are having procedures. And so I think as we talk about a way back, it is testing patients who need procedures. It is requiring, obviously, limited in and out of the hospital, making sure that there's mandatory masking of everyone who's in the hospital, and not cohorting patients to the extent that that's possible. That's inside the acute care settings. In the community, I think that the community needs to not get fatigued. As Dr. Hebert mentioned at the start of our conversation, people are anxious. They are feeling things that they have never felt before. And there's a certain amount of COVID fatigue that exists as well. We've had Thanksgiving, we're coming into Christmas, it's Hanukkah, these are the holidays, right? These are times where we recharge ourselves as a family unit, and people just got to hold on, because you see what's happening with this surge across the country today. California is requesting body bags and refrigerated trucks because they have more people dying in Los Angeles. We're not talking about remotely, we're talking about Los Angeles today is requesting this. So this is a very, very real pandemic. We have to take it seriously in the communities, continue to social distance. We have a light at the end of the tunnel. It is the vaccination. We must continue to wear masks until we have enough, 60, 70% of the population. So we start to look at what everyone is referring to as herd immunity. It's going to be at least a year and a half before we think about stopping to wear masks. And if we can get this disease behind us, if we can get this period of sufferation and death and dying behind us, then we can get to economic recovery as a community. It will allow us to heal the divides. And then we got to keep our African-American and our Latinx communities safe. We've got to make an investment into their healthcare so that when the next pandemic comes, we're not dying like this.
Well, that was going to be my next question regarding how long did either one of you guys think that we would be continuing to wear masks? So you did answer my question on that. And I'm in the same camp. I'm going to continue to wear my mask, whether I'm, going out in public, going to the grocery store, even after I've been vaccinated. It is my plan to continue to wear my mask well into 2021 and 2022 if I need to. Another question I have for you, Dr. Hebert, is about the vaccine, and if you think that this will be an annual thing that we will need to do, or is this going to be enough? Will the one dose or the 2-dose vaccine be enough? Have we gathered enough information to know if we will have to have this annually, just like we do the flu vaccine?
Yeah. Well, there are a couple of things that I think are very important here, that I want all the community that happens to be listening to this right now. We got a real sweet spot for African Americans to get this vaccination. Okay. And one of that sweet spot, I want people to start recognizing that the Thanksgiving numbers, that surge that we were supposed to see right between 3 and 4 weeks, we're starting to see it. So people are very, very nervous about that, right? But they're also nervous about the vaccine because the vaccine just became available. So what's going to happen is they see the numbers go up of people that actually are getting the vaccination, but they see the numbers go up of people dying. And right in that spot, which is going to be probably 3 to 4 weeks after Christmas, as they see those numbers go up, and then they see the numbers of people that have gotten vaccinated go up and nobody's having any issues, that's going to be our sweet spot for African Americans to take this vaccine, because they're going to be like, I'm scared as hell and nobody's down for the vaccine. I need to go ahead and do it. So as we start doing our outreach programs for our community, as we start doing our Zoom calls and our Skype calls and our television interviews, we have to make sure that sweet spot, like around like that mid-January, is when we got to hit us hard, because that's where we're going to feel the most impetus to move forward. But what I do think when it comes to do I think it's going to be an every year thing? I think it's probably going to be an every year thing for a couple of years, maybe. But I don't think it's going to run, every year for a very long time, because we have to know, the mRNA, I mean, the RNA viruses like SARS and all these things, we didn't even ever have a vaccine really for SARS that was commercially available. And then we have no vaccines for like rhinovirus and generally coronaviruses, because these things are not very complex viruses. You look at a virus like the measles, okay, that is a DNA virus that has an R naught of 18. This has an R naught in some places of 1.5 to 2, which means 1.5 to 2 people be infected in the room if you come in there with COVID-19. But with measles, you 18 people are going to be infected if you walk into that room. So lots of our viruses that are really complex that we have to have vaccines that you take them and they last forever. It's because the vaccine is being related to the actual virus that is a very complex virus. So I see that this is going to be with us for a while because we've got to get herd immunity. And because people aren't taking the vaccine, it's going to be hard for us to get 70% herd immunity in this year, especially when you have to take 2 doses. But the reality is that I think it's going to be a couple of years, and then I think it's going to be a little bit more optional. And another thing is that we have to make big decisions here. There was a group of people that sat on the ACIP, which is the group that actually for the CDC that decides who, what, when, where, and why, who's going to get the vaccine. And half of them said, we'd rather give 1 shot to everybody, which will give 50% immunity, as opposed to 2 shots to just the healthcare workers and the people that live in the nursing homes, because that will give them 95% immunity. But would it be better to give everybody the vaccine right now to get to 50% with a 1-shot deal? It's a very sticky situation, and people fought about this for months, man. So, you know, I'm not sure which way I fell on it. I'm a doctor, so I want to be protected more than anybody else, because if all of us start dying, nobody will be there to protect us. But at the same time, which will get us to herd immunity first? So, you know, these are really serious decisions that have to be made. And either way, we're going to be fine, because in 1918, they didn't have vaccine, they didn't have TV, they didn't have internet. And that's why your stress is more, because when in 1918, all you heard was, hey, man, there's a pandemic in Pittsburgh, but I'm in Miami. What am I supposed to do? Okay, I guess I'll read the paper. Then that's the stress you had. Now, constant 24-hour news, which I feel like I'm a part of, so I'm sorry about that. But you constantly are being bombarded with this stuff. So in 1918, they didn't have anything. And we're still here. We're still here. So we're going to be here through this. Your job is to wear your mask so you can be here through this.
You know, Corey, I think a lot of what you say is so solid. And, you know, one of the things that gives me hope for the African-American community is that most people in the African-American community know somebody who died of COVID, who was in the ICU because of it. And so there is a respect in our community for it. And so I think if doctors who represent our community speak to our community and have been symbolic leaders in the way that we have early on and looking at the science and getting vaccinated ourselves, that gives me great hope. And you pointed to a scientific point where folk can really index on when that action should be. And you have to be smart about that as well, right? It's about to be Christmas. You know, it's not readily available for the general population right now. So do you begin, you know, doing a lot of print media and campaign and things like that before? And you've given a great visionary 4-point to where we should really concentrate all of our efforts and use that data point as a time for maximum community outreach. I love that.
So one question that I'm sure people will want to know is that when the vaccine does become available for the general public, will there be a charge? Will your insurance company cover it? Will you have to pay out-of-pocket costs for it, or will it be covered?
Didn't Donald Trump tell you that? I told you I need to be listening to your president. That is your president. He told you it's going to be free. Make America great again. I'm just joking. I'm just joking.
Edit that out.
Edit that out.
People will have that question, and I'm of the mindset that there should not be a charge. Our health center is not charging for COVID testing.
Yep.
We've paid for these tests. Yes, we are a fairly qualified health center, but I believe that people deserve to receive testing so they can know their status, and that will determine if they're going to stay in their house in quarantine or if they can go out in public and go to work. So I'm an advocate for the test being free as well as the vaccine being available to the public for free.
No, I agree with that wholeheartedly. And I think, really, we're in the middle of a global pandemic. There are millions of Americans who are unemployed. There are millions of Americans who have lost their insurance benefits. We know that people who are brown and Black have been hit with this, both economically and from a health standpoint, in incredibly detrimental ways. And so I think if we want to stop that, we have to get it to the people. So it's not only just making it available free, it's making it available in the communities where the people reside, right?
Correct.
You cannot expect people to come. You've got to take this. This really needs to be a tour de force of understanding where patients and populations live and how they use healthcare, and plugging them in, not just for this, but use this as an opportunity perhaps to start longitudinal treatment of these patients too over time.
In our state, in Louisiana, the vaccine will be free. I think with the Biden administration taking control of this and having a national mindset as opposed to this state and local mindset that our past president had, I think it's going to make a really big difference in the way that we roll this thing out. I do want to make sure, because this is going to be obviously on the web, but Indiana is where you are based, Dr. Seabrook, and we cannot forget the Black rural populations. We talk about Black urban populations all the time, but the Black rural populations a rural population is most likely to die from this, and that they're going to be least likely to get the vaccine and have the vaccine least available to them. So we have a lot of Black people live in rural areas. I mean, I know once you pass St. Louis, you don't see Black folks till you get to LA. I know that. But up until from us all the way to St. Louis, from the East Coast to St. Louis, there's a lot of rural African Americans, so we cannot forget them as well.
Yeah, I think, the other thing that you point to, Corey, as we talk about where community-wise is who pays for this, right? And I think, people who are politically minded, this is really time. I think there's, I forget the total number, is $9 billion or so that's in this next care package that is money that's supposed to get to the states so they can get the vaccine out. And so, for folks who are politically minded, I think this is a wonderful opportunity to use political leverage as well to encourage your representatives to pass federal spending so that states and communities, municipalities who know the communities, like you mentioned in Indiana, or like we have here in Kissimmee, in Orlando, we know where we need to get those vaccines, that we could get funding to do so.
Sure, I agree.
So what I'd like to hear from you both is a confirmation and your recommendations on the vaccines.
I will say I've gotten the vaccine. I think that as full disclosure, I'm not sure whether I got the placebo or the vaccine. I will know when it's unblinded, which is very soon, because that's part of the deal that once a commercially available vaccine came out, we will be able to know if we were blinded if we were placebo or not. But if I got the placebo, I'm going to get the other vaccine, either Pfizer or Moderna. I will say, even if I did get the vaccine and not the placebo, I may go ahead and double up. Because look, I'm not trying to have any problems, and that's how much I believe in vaccines. And the funny part, just as an aside for folks that are listening, I don't believe in all vaccines. I do not. I do not believe in the oral polio vaccine, because it's the only vaccine that can give you polio in the United States. The only people that were getting polio in the United States were people that were getting the oral polio vaccine, and that was up until 2002, 2003. So what I'm saying is, this is not this is an imperfect thing. But when we talk about something like this that's killing folks, you got to get the vaccine. So that is my stamp of approval. Bum, bum.
Yeah, I think my greatest witness to what I think about the vaccine is the fact that I rolled up my sleeve and took the vaccine. So as a father, a husband, a community leader, a physician, a surgeon, a scientist, I think the data is solid. I think that the risk is minimal. And I think that what we're really dealing with is an issue of community trust of science. And so I absolutely would recommend that the community get vaccinated as quickly as the vaccines are available to them. And then we could really start thinking about what tomorrow looks like post COVID-19.
Well, full disclosure for me, my husband is a physician, and he did take the vaccine on Friday the Pfizer vaccine because he actively goes into the hospital every day to round on all of his patients, including COVID patients. So he did take the vaccine. My health center, a federally qualified health center, will probably be in the next wave in January, and we will receive those vaccines, and I plan on taking the vaccine when it's available. I did not want to skip and jump the line because I don't go into the hospital every day, and I don't see patients every day. And to my knowledge that I know of, I have not been exposed to anyone with COVID. So what I try to do is to make sure that I have the information that I need. But again, I did not want to jump the line in front of people who are going in and out of the hospital every day and seeing patients and putting their lives and their families' lives at risk. I thank you both. Dr. Simmonds, how can we get in touch with you if people want to know more about you?
I think the best way is LinkedIn. My LinkedIn profile is updated with all of my connections and things like that. So thank you so much. It's been a privilege to be able to be in a mind meld with you. And I really hope that people who have listened to this discussion we've had this morning feel inspired and enlightened and really use this as a call of action to take better care of themselves.
Thank you so much. And Dr. Corey, how can we get in touch with you?
You can go LinkedIn, Twitter, Facebook, Instagram, all those types of things that annoy me to the hilt, but are necessary for us to disseminate information to our people. But I will say in closing, you got about, I told you in March, you had about 90 days to get high school fine so that you don't get sick. I'm gonna give you another 90 days. Look at that high school picture and put that picture up on your little mirror so you look at it, because if you lose 10% of your body weight, the odds are you probably won't die from COVID, and you probably won't have your diabetes or your hypertension anymore. So this is a clarion call for everybody to get healthy, because this pandemic is here, but you don't know what's around the corner. You don't know. So you got to be ready. You have to be ready. And like my boy said, if you stay ready, you don't have to get ready.
Always eternal words of wisdom from Dr. Corey Hebert. You can reach me, Dr. Janet Seabrook, on my Facebook profile, as well as LinkedIn, and my website, drjanetseabrook.com. Your health matters. Thank you all so much. I appreciate it.
Community Health Net Health Centers. Rooted in the communities of Northwest Indiana, Community Health Net Health Centers offer family practice, pediatrics, behavioral health, OBGYN, eye care, and dental. Community Health Net Health Centers provides compassionate health care for all.